If you have diabetes, there's a lot more to managing your blood sugar than just diet and medication. Many people don't realize that simple everyday habits, like how you sleep, stay hydrated, handle stress, or even the over-the-counter medicines you take, can have a big impact on your blood sugar and overall health. In this video, I'll share important habits and tips that most diabetics aren't aware of. These small changes can help you avoid complications, improve insulin sensitivity, and keep your blood sugar more stable. If you want to take better control of your health and avoid hidden risks, keep watching as this could make a big difference in your life. Let's begin with number one. 1. Manage blood sugar spikes. Blood sugar swings aren't just frustrating, they're dangerous. They can increase the risk of heart disease, nerve damage, kidney failure, and vision loss. A key study in diabetes care found that even if two people have the same A1C, the one with more blood sugar fluctuations has a higher risk of cardiovascular events. Research in diabetes, obesity, and metabolism confirms that frequent spikes and drops worsen insulin resistance, making diabetes harder to manage over time. Every spike in blood sugar triggers oxidative stress and inflammation, damaging blood vessels and accelerating cellular aging. High glucose levels lead to the overproduction of reactive oxygen species, ROS, which harm nerves, eyes, and kidneys. A study in cardiovascular diabetology found that glucose variability increases arterial stiffness, a major risk factor for heart attacks and strokes. Nerve damage starts early, often without symptoms. A study in diabetes research and clinical practice showed that patients with greater glucose variability were more likely to develop neuropathy. The eyes suffer too. Constant swings weaken the tiny blood vessels in the retina, increasing the risk of diabetic retinopathy and vision loss. Research in ophthalmology confirms that glucose variability is a key factor in retinopathy progression. The kidneys, already vulnerable to diabetes, take another hit when blood sugar levels fluctuate excessively. Studies show that glucose variability accelerates kidney function decline in patients with diabetic nephropathy. The biggest threats are severe lows and prolonged highs. Hypoglycemia is an emergency. The brain depends on glucose, and when levels drop too low, cognitive function declines rapidly. A study in diabetes found that repeated hypoglycemic episodes increase the risk of dementia. Mild cases cause dizziness and weakness, while severe episodes can lead to seizures, coma, or even death. Sudden drops also put the heart at risk by triggering dangerous arrhythmias. Chronic high blood sugar is just as dangerous. A long-term study in the New England Journal of Medicine confirmed that sustained hyperglycemia significantly increases the risk of kidney disease, nerve damage, and blindness. Unlike hypoglycemia, which has immediate symptoms, high blood sugar quietly destroys organs over time. The worst-case scenario is experiencing both, frequent crashes alongside prolonged highs. This weakens the body's ability to regulate glucose and accelerates complications even further. Blood sugar swings not only increase the risk of severe complications, but also make diabetes harder to control over time. A study in diabetologia found that patients with greater glucose variability had higher mortality rates compared to those with stable blood sugar levels, even when A1C was similar. Avoiding highs isn't enough. It's about preventing sharp rises and drops altogether. The body thrives when blood sugar remains steady, reducing stress on vital organs and lowering long-term risks. Research confirms that minimizing glucose variability leads to better health outcomes, making it one of the most critical yet overlooked aspects of diabetes management. 2. Early detection of complications. Diabetes complications don't always come with warning signs. By the time symptoms appear, damage may already be serious. A study in the New England Journal of Medicine found that early detection of kidney disease through microalbuminuria testing significantly reduced the risk of kidney failure. Research in ophthalmology confirmed that routine retinal screenings detect diabetic retinopathy in its earliest stages, preventing severe vision loss. Heart disease is the leading cause of death in people with diabetes, and the warning signs aren't always obvious. A study in Circulation found that detecting arterial stiffness and subtle changes in heart function years before symptoms appear can cut the risk of heart attacks and strokes. Regular monitoring of blood pressure, cholesterol, and cardiac markers helps identify cardiovascular risks before they turn life-threatening. Nerve damage starts early, often without noticeable symptoms. A study in diabetes care found that early signs of neuropathy, such as reduced nerve conduction velocity, appear long before symptoms like numbness or pain. Catching neuropathy early through nerve function tests can slow its progression and prevent severe complications like foot ulcers and amputations. The key to early detection is consistent monitoring. Routine blood tests, eye exams, kidney function tests, and cardiovascular screenings. 3. Stop skipping meals or overeating. Irregular eating patterns wreak havoc on blood sugar control. Skipping meals forces the body into a stress response, triggering cortisol and adrenaline, which can cause blood sugar levels to drop sharply. For people on insulin or glucose-lowering medications, this increases the risk of severe hypoglycemia. A study in diabetes care found that skipping meals leads to greater glucose variability, worsening overall glycemic control. Prolonged fasting can also make the body more insulin resistant, leading to higher blood sugar levels when a meal is eventually consumed. Overeating, especially high carbohydrate meals, causes sharp spikes in blood sugar. This triggers excessive insulin release, which can lead to a rapid crash, causing fatigue, irritability, and cravings. Research in the Journal of Clinical Endocrinology and Metabolism showed that frequent overeating contributes to insulin resistance, making blood sugar harder to control over time. Overloading the body with food also strains the digestive and cardiovascular systems, increasing the risk of obesity, fatty liver disease, and heart disease. Alternating between skipping meals and overeating is the worst-case scenario. This pattern confuses the body, leading to erratic blood sugar levels, increased insulin resistance, and a higher risk of long-term complications. A study in Diabetologia found that people with irregular eating patterns had a higher incidence of metabolic syndrome and cardiovascular disease compared to those with consistent meal timing. Consistency is key to stable blood sugar and better health. 4. Manage stress. Stress spikes blood sugar, and it happens fast. It doesn't matter if it's work stress, family problems, money issues, or even physical stress like being sick or not sleeping enough. Your body reacts the same way. It raises blood sugar. When you're stressed, your body thinks you're in danger and switches to fight or flight mode. It releases cortisol and adrenaline, which tell your liver to dump extra glucose into your bloodstream for quick energy. But you're not running from danger, so that sugar just sits there, keeping your blood sugar high. A study in diabetes care found that people under chronic stress had consistently high blood sugar, even when they were eating well and taking their meds. Cortisol also makes insulin resistance worse. The longer it stays high, the less effective insulin becomes. Research in the Journal of Clinical Endocrinology and Metabolism confirms that cortisol raises fasting blood sugar, causes bigger swings, and makes diabetes harder to manage. And stress isn't just about hormones, it changes how you eat. A study in appetite found that stress makes people crave high-carb, high-sugar foods, which lead to spikes and crashes. If you're stress eating while cortisol is already raising blood sugar, it's a double hit to your glucose levels. Stress also wrecks your sleep, which is terrible for blood sugar. A study in diabetes, obesity, and metabolism found that people with high stress sleep poorly, which raises fasting glucose and increases the risk of type 2 diabetes. Poor sleep makes your body less responsive to insulin, increases inflammation, and makes diabetes even harder to control. It doesn't stop there. Stress raises blood pressure, increases the risk of heart disease, and speeds up nerve damage. A study in Circulation found that people with high stress had a much higher risk of heart attacks and strokes. The good news: managing stress lowers blood sugar spikes and protects against long-term damage. Research proves that meditation, deep breathing, and exercise improve insulin sensitivity and lower A1C levels. Even small habits like walking, listening to music, or just taking short breaks help regulate blood sugar and reduce stress's impact on your body. 5. Identify nutritional gaps and micronutrient deficiencies. Most people think blood sugar control is just about avoiding sugar. It's not. Your body needs the right nutrients to keep insulin working properly. If you're low on key vitamins and minerals, blood sugar goes up, Inflammation rises, and complications speed up. Vitamin D is one of the biggest deficiencies in people with diabetes, and it's a serious problem. It helps with insulin sensitivity and inflammation control. A study in diabetes, obesity, and metabolism found that low vitamin D is linked to higher A1C and an increased risk of heart disease. If you don't get enough sun or eat vitamin D-rich foods like fatty fish and egg yolks, your insulin function is probably suffering. Magnesium is critical for blood sugar regulation, but most people don't get enough. Research in diabetes care found that low magnesium levels increase the risk of insulin resistance in type 2 diabetes. Magnesium helps your cells absorb glucose and prevents oxidative stress, which protects against nerve damage and heart disease. Best sources: nuts, seeds, and leafy greens. Vitamin B6 is crucial for nerve health. Diabetes damages nerves over time, but getting enough B6 can help slow the process. A study in the Journal of Neurological Sciences found that B6 deficiency worsens nerve damage in diabetics. Best sources: beef liver, turkey, and sunflower seeds. Zinc is essential for immune function and wound healing, two things diabetics struggle with. A study in the American Journal of Clinical Nutrition found that zinc deficiency slows insulin production and increases inflammation. Since diabetics heal slower and get infections more easily, zinc is critical. Best sources: red meat, shellfish, and pumpkin seeds. Omega-3 fatty acids reduce inflammation and protect the heart. People with diabetes have a higher risk of heart disease, and omega-3s help keep blood vessels healthy. Research in circulation confirms that omega-3 intake improves cholesterol and reduces inflammation. Best sources: wild-caught salmon, sardines, and flax seeds. Choline is critical for liver function and fat metabolism. A study in the Journal of Diabetes Research found that choline deficiency is linked to a higher risk of fatty liver disease, which is common in people with insulin resistance. The liver plays a big role in blood sugar control, so getting enough choline is important. Best sources: eggs and beef liver. Missing these nutrients makes diabetes harder to manage, increases inflammation, and speeds up complications. A balanced diet with the right vitamins and minerals helps stabilize blood sugar and protect your organs. Research proves that fixing these deficiencies improves blood sugar control and lowers the risk of complications. 6. Maintain hydration. Most people don't realize how important water is for blood sugar control. Dehydration raises blood sugar, worsens insulin resistance, and makes it harder for your body to flush out excess glucose. A study in diabetes care found that people who drink less water have higher blood sugar levels and a higher risk of developing diabetes. When you're dehydrated, your blood becomes more concentrated, meaning higher glucose levels. On top of that, the body releases vasopressin, a hormone that tells the liver to make even more sugar, making things even worse. Hydration is also critical for kidney health. Since diabetes already raises the risk of kidney disease, staying hydrated helps flush out excess glucose and toxins. Research in the American Journal of Kidney Diseases confirmed that proper hydration lowers the risk of kidney function decline. When you don't drink enough water, your kidneys work harder, which speeds up kidney damage. Dehydration worsens insulin resistance too. A study in the Journal of Clinical Endocrinology and Metabolism found that even mild dehydration makes insulin less effective, causing higher blood sugar, more oxidative stress, and more damage to blood vessels and nerves. The fix? Drink water consistently throughout the day. Sugary drinks? Avoid them. They spike blood sugar and make dehydration worse. Too much caffeine and alcohol? They dehydrate you, so keep them in moderation. Research shows that staying hydrated improves glucose control, protects kidney function, and lowers the risk of complications. 7. Manage your sleep. You might be watching your diet and taking your meds, but if you're not sleeping well, your blood sugar could still be all over the place. Sleep isn't just about rest. It directly affects your insulin and glucose levels. A study in the Lancet Diabetes and Endocrinology found that even one bad night of sleep can reduce insulin sensitivity by 25%. That means your body needs way more insulin to keep blood sugar in check. And the more sleep-deprived you are, the worse it gets. Not sleeping enough also messes with your hunger hormones. Research in the Journal of Clinical Endocrinology and Metabolism showed that people who get less than 6 hours of sleep have higher levels of ghrelin, the hunger hormone, and lower levels of leptin, the fullness hormone. Translation: you'll be hungrier, crave more carbs, and end up with bigger blood sugar spikes. And if you have an irregular sleep schedule, that's a problem too. A study in diabetes care found that people with inconsistent sleep patterns had higher A1C levels and more blood sugar fluctuations. That's because sleep helps regulate insulin production, so when your sleep is all over the place, so is your blood sugar. One more thing, if you snore a lot or wake up tired, you might have sleep apnea, which is common in people with diabetes. Research in the American Journal of Respiratory and Critical Care Medicine found that treating sleep apnea can improve insulin sensitivity and lower fasting glucose. So, what's the fix? Get on a sleep schedule, avoid caffeine before bed, and if you have trouble sleeping, talk to your doctor about it. Studies show that improving sleep lowers cravings, stabilizes blood sugar, and helps you feel better overall. 8. Avoid inactive lifestyle. A sedentary lifestyle is one of the biggest contributors to poor blood sugar control, insulin resistance, and diabetes-related complications. Lack of physical activity slows glucose metabolism, increases inflammation, and raises the risk of heart disease, neuropathy, and kidney damage. Inactivity directly worsens insulin resistance. A study in diabetes care found that just 5 days of bed rest significantly reduced insulin sensitivity, making it harder for the body to regulate blood sugar. Without movement, glucose remains in the bloodstream longer, leading to higher blood sugar levels and increased oxidative stress, which damages blood vessels and nerves. Prolonged sitting spikes post-meal blood sugar. Research in the Journal of Applied Physiology showed that sitting for long hours after eating leads to prolonged glucose elevation, even in people without diabetes. In contrast, light activity, such as standing or walking for a few minutes after meals, reduces blood sugar spikes and improves insulin function. Muscle inactivity reduces glucose uptake. Skeletal muscle is the largest site for glucose disposal, but when it remains unused, glucose isn't efficiently absorbed, leading to higher blood sugar levels. A study in The Lancet found that people who engaged in regular physical activity had a 30% lower risk of developing type 2 diabetes compared to those with sedentary lifestyles. An inactive lifestyle also accelerates complications. Research in circulation confirmed that lack of exercise increases the risk of cardiovascular disease, which is already the leading cause of death in people with diabetes. Inactivity also worsens neuropathy by reducing blood flow to nerves and increases the risk of kidney disease by impairing circulation to the kidneys. The best way to counteract these risks is by incorporating consistent movement throughout the day, not just structured workouts, but also simple activities like walking, stretching, or standing after meals. Studies show that even low-intensity activity significantly improves blood sugar control, making physical movement one of the most powerful yet underutilized tools in diabetes management. 9. Be careful about medications. Many over-the-counter OTC medications seem harmless, but for people with diabetes, they can interfere with blood sugar control, insulin function, and overall health. Certain drugs can cause blood sugar spikes, increase insulin resistance, or put extra strain on the kidneys and heart, leading to serious complications if not used cautiously. Common pain relievers, like NSAIDs, ibuprofen, naproxen, can impact kidney function. A study in the American Journal of Kidney Diseases found that frequent NSAID use increases the risk of kidney damage, especially in people with diabetes who already have reduced kidney function. These drugs reduce blood flow to the kidneys, potentially worsening diabetic nephropathy. Decongestants and cold medications often contain pseudoephedrine or phenylephrine, which raise blood sugar and blood pressure. Research in the Journal of Clinical Pharmacology confirmed that these ingredients stimulate the release of stress hormones, leading to increased glucose production by the liver. This makes them risky for people with diabetes and hypertension. Antihistamines, commonly used for allergies, can affect insulin sensitivity. A study in Metabolism, Clinical and Experimental, found that certain antihistamines, especially first-generation types like diphenhydramine, may contribute to weight gain and worsen glucose metabolism over time. Corticosteroids, even in over-the-counter creams or nasal sprays, can elevate blood sugar levels. Research in diabetes care showed that corticosteroids increase insulin resistance and can lead to prolonged hyperglycemia, especially when used frequently or in high doses. Antacids and acid reducers can also interfere with glucose regulation. Proton pump inhibitors, PPIs, like omeprazole, have been linked to increased diabetes risk. A study in the British Medical Journal found that long-term PPI use was associated with higher fasting blood glucose levels and increased risk of developing type 2 diabetes. The safest approach is always checking labels, consulting a healthcare provider, and opting for alternatives that don't impact blood sugar or kidney function. Research proves that even seemingly minor medications can significantly affect diabetes management, making awareness and caution essential when using over-the-counter drugs. 10. The need for regular medical checkups. Regular medical checkups are essential for preventing complications, catching health issues early, and optimizing diabetes management. Many diabetes-related complications develop silently, showing no symptoms until significant damage has already occurred. Routine screenings and medical assessments help detect problems before they become severe, improving long-term health outcomes. Frequent monitoring lowers the risk of major complications. A study in the New England Journal of Medicine found that patients who attended regular checkups had significantly lower rates of kidney failure, blindness, and amputations compared to those who delayed medical visits. Early detection allows for timely interventions that can slow or even prevent complications. Kidney function tests, such as microalbuminuria screening, can detect early signs of diabetic nephropathy. Research in the American Journal of Kidney Diseases confirmed that annual kidney function tests help slow the progression of kidney disease, reducing the risk of dialysis. Since diabetes is a leading cause of kidney failure, regular monitoring is critical. Eye exams are crucial for preventing vision loss. A study in ophthalmology found that yearly retinal screenings reduce the risk of severe diabetic retinopathy by over 50%. Many people don't notice vision problems until the condition is advanced, making routine screenings essential for preserving eyesight. Cardiovascular health monitoring can prevent heart attacks and strokes. Research in circulation showed that regular blood pressure, cholesterol, and ECG tests help identify cardiovascular risks early, leading to better management and a lower risk of fatal heart events. Diabetes significantly increases the likelihood of heart disease, making cardiac screenings a key part of medical checkups. Nerve function tests help detect early-stage neuropathy. A study in diabetes care found that patients who underwent regular neuropathy screenings were more likely to receive early treatment, reducing pain and preventing severe nerve damage. Since neuropathy is often painless in its early stages, routine testing is essential. Regular checkups are more than just a precaution. They are a life-saving strategy that ensures complications are caught early, treated effectively, and prevented whenever possible. Research proves that proactive medical care leads to better long-term outcomes, making routine screenings a cornerstone of effective diabetes management.